Welcome to Latina in America, your bilingual destination for all things Latina about our diverse culture, professions, and passion to travel. I am Rosie. Our special guests will share their career journeys and will take us to amazing places around the world. On some episodes, they will take you on those journeys in Spanish. Así es, en español. So come on and join me. Let's learn and travel. And what an honor it is to have with us today Dr. Brenda Santellano, a physician and clinical oncology researcher. She is passionate about advancing medicine and enhancing patient care. We will talk about her journey, the impact of her latest findings on different types of cancers, such as skin, colorectal, and gastrointestinal. We also talk about the importance of screening, the technology available for diagnosis, and what drives her passion for making a difference. Dr. Brenda, welcome to Latina in America.
Hi, Rosie. Thank you so much for the invitation today. I am really honored to be here, to be able to speak out to your audience about my experience as a doctor, as a woman in the medical field. I'm really excited to talk with you today, your audience.
I learned about you because of the power of social media. And I learned that you are passionate about advancing medicine and improving patient care. Tell me about your upbringing, your childhood and culture, and your journey to medicine and clinical research.
I am from Mexico. I live in different places in Mexico, Guanajuato, Mexico City, in the north border of Mexico, Mexicali. I am from a small town, grew up in a farm, a big family. We are 10 brothers and sisters, so we are a big family. So that makes a huge difference in my background, how I see different things, how I perceive a career in general and a career in medicine. I started med school in Mexicali. I finished my med school there. Then I moved to Mexico City to do my internship. I lived there for 3 years. I did my internship, that is 1 year. Second year, I did the social service. That is part of a requirement to graduate from med school. And there is where I have my first experience doing the clinical part of medicine together with research. And there is where I fall in love pursuing this career doing the clinical part of medicine, doing research, because I feel like when you do research in medicine is when you're really advancing medicine. You are looking for new medications, you are looking for new ways to improve your patient care in every day. And even when I love taking care of patients in the daily basics, seeing them in the clinic, prescribing their medication, follow-ups, I feel like when you're doing research, you are helping not only one patient, you are helping patients out of your country worldwide.
That is so important because in that selection of what I'm going to study and how am I applying what I learned in the studies, the theory, the observations, and the actual results. So very interesting. And in doing so, what is a day in the life or a month in the life for someone like you that might help another person who would like to do the same things that you're doing now?
I had the experience to do primary care provider where you see patients every day in your consults. I also work in the urgent care and you never know what to expect. So you need to be ready for anything. Anything can happen in your day. I like that, but I was missing that part about research. And that is where I start looking forward to bring back to my career the research part. So I needed to look for institutions, cities, or even a different country. Start to put together my CV, my requirements to look for opportunities. I found that opportunity here, so I moved to the US and I started to practice both the clinical part and the research part. And is where I found what I really love. And when you combine the clinical and research part, it's pretty different because you don't see patients every day. And the patients that you see, they are more complicated patients. So you need to see them in a multidisciplinary way. I moved from seeing patients 5 days per week to see patients just 1 day per week. And most of your week, you invest your time doing research. And I do clinical research, and it's something that I want to emphasize that it's clinical research. You work with patients' data, and some of that data is data that you extract while you are seeing your patients. Sometimes you need some of their experience with some medications. So you ask their patients how they are doing with some medications that we are proving, if they have different symptoms. So you extract that information from the patients you saw. In clinical research, you need to go back to the patient's charts. So your question was how it looks during the clinical part and the research part. You're going to invest most of your time doing clinical research, evaluating the patient's data, how they are doing with some medications, how they are doing when you switch from one medication to other, and you're going to reduce your patient's time to maybe 1 day per week.
That's a very good information because for someone who is in the process of deciding what will be the best one that will fit me or what is my passions. So, on doing clinical research, what brought your passion to that field?
That's an interesting question because you need to start looking for what you really love doing. I started my career doing engineering because was the recommendation from my mentors. So they told me you should look for something in engineering, that's the future. I started doing engineering, but I found that I like it, but I didn't feel that fulfillment. I like physics, I like math, I am good doing this, but maybe it's not for me.
Like, I can do it. Of course, I can do it. But is that going to fulfill me? Because you're looking in the long term. So I'm so glad that you're making that distinction that yes, you were good at it and you could do it, but what else is there?
Exactly. So I started looking for something that I really like it and I really enjoy doing. And I decided to apply for med school. And telling my mentors, telling my family that I wanted to move from engineering to go to med school was like, hey, wait, what are you thinking about? Med school is expensive. It's a pretty long career. How are you going to pay for med school? Different career like engineering, sometimes you have time to work while you're studying. So I listened all of that, but I didn't pay attention. I decided to start studying, to take my med school test, and even my mentors in engineering told me that was something hard for me at that moment because they told me you have a pretty good profile for engineering. And at that point, I was already approved to go to med school. So I was like, oh, okay, well, thank you for your advice, but I'm moving to med school. It was hard at the beginning. It was pretty hard for me, but I prefer doing this because I like it instead of being in a place or doing something that I didn't enjoy doing. So that was the beginning of my career in medicine. And from there, I started applying for scholarship. Those scholarships helped me to move to Mexico City, then to go to internship, to do some summers in research, which also make a huge change in my career. Doing research, you can have also the opportunity to explore the world because doing research gave me the experience to present my work in other countries. In London, I also present in Florence, in Italy, looking for opportunities. I receive a lot of rejections, but I start thinking, okay, every rejection is another opportunity.
What are some of the challenges that you experience going through the process of being where you are right now?
Yes, just like a few days ago, I start using Google Maps to look what was the time to travel between where I used to live to my elementary school in Mexico, because in my mind, I used to walk like an hour or more to school. And I Googled it because I said, maybe I will remembering that. And it was around an hour. For a kid, it was more than an hour walking. But I don't remember that as something that I struggle. I remember that every day I walk, wake up, happy to go to school. For me, that was one of the first challenges in my life. Be able to go to school, because I don't think a lot of people want to walk an hour or more to go to school.
It builds that muscle of determination and persistence. Because when you're walking, not every day was a beautiful sunny day. No, sometimes that walk could be even more challenging because of the weather or other things that you encounter.
That's it.
I can imagine. And that is another building block on your persistence and determination. Yes. And oncology, how was that decision of going into oncology? Also, what kind of breakthroughs are you looking at this point on that?
The first opportunity that I looked to for doing research was something related to nutrition. When I arrived, it was related to nutrition, but not the way we are thinking about nutrition. It was about cachexia. Cachexia is a syndrome that waste of muscle is usually present in patients that have chronic illness. From there, I follow up with that mentor because I really like it, how they work as a team in the research team. And I moved with them to another big institution. And there we started combining the research on nutrition and respiratory diseases and on heart diseases, that everything is combined. And I think that's where my engineering mind is combined with medicine, because it's the systems are integrated. Then I focus only in primary care, and then I found this opportunity doing oncology. And you can say, oh, oncology maybe it's not too related to nutrition, maybe it's not too related to respiratory disease or cardiovascular diseases. No, everything it's related. And nowadays it's starting to grow a new field. I think in the last years is starting to grow this new field that is cardio-oncology, where we focus more in how the cardiovascular diseases can increase the risk to cancers, and how some cancers, some medications that we use for cancers can increase the risk for some cardiovascular diseases. So everything is interrelated, and that's what I love about medicine.
It's not isolated. Everything is interrelated. And now you're in the United States, correct?
Exactly. Now I'm here in the US. I've been here for almost 3 years. Right now, I am focused on colorectal cancer and skin cancer, two of my biggest projects. For the colorectal cancer, we work with the Georgia Colorectal Cancer Control Group, and we got an award from the Cancer Society for increasing the colorectal cancer screening above the 80%. That was our main objective with this project. And here in Georgia, we have a lack of providers, we have a lack of resources, and that's how we work with these projects to bring to the community, because this project is focused on bringing resources to rural areas in Georgia, mainly in the southeast of Georgia. So we educate providers, we educate patients, talking to them in a familiar language, so they are more proud to get screening. And with colorectal cancer, there is also a big bias. Well, in general, I would say the population is afraid to get the screen, because you don't want to hear bad news. And also some screenings are not comfortable for some patients, because in colorectal screening, you need to collect a stool to get screening. So patients are like, oh, I don't really want to do that. But we try to manage that to make it as easy as possible for the patients, so they feel comfortable doing the screening. And now there are some different screenings that are easier, that are more comfortable for the patients. So we try to do that with these communities here in Georgia. And that's a big program that we have. And for the skin cancer screening, we focus on melanoma. But there is not only melanoma, there is basal cell carcinoma and squamous cell carcinoma. But the big deal so far is melanoma, because I'm sure you hear before about screening about breast cancer, screening about colorectal cancer, screening about lung cancer, but we don't hear too often in the news or so about melanoma. And melanoma is predicted to be the second leading cause of death related to cancer for 2040. So that's why we are starting to work right now to increase the awareness of screening. And I had this experience in my family where my sister got diagnosed with melanoma, one of the worst melanomas, and she waits 2 years to get screened and to get diagnosed. And when she got diagnosed, it was just on time before it started to spread all around her body. So that's something that also makes me feel more close to the patients, close to the community, talking to patients, talking to the community. Hey, these are the resources that we have. Most of these resources are for free. Cancer screening, different from other screening, is pretty easy, it's pretty fast. And we only need to use a dermoscope, that is a kind of a small microscope where you look to the patient's skins. You are able to identify if this lesion is benign or malign. And we have a program that is teledermatology, where we use a platform where providers from rural areas where there are no dermatology access, they take these pictures with the moloscope, and then we refer these pictures to a dermatologist. And in 5 minutes or less, they have a diagnosis, and they have recommendations for follow-up, or this patient should get surgery of this treatment or biopsy. So we are bringing these resources to the community. And recently, last month, we would approve another project that is to provide free sunscreen dispenser here in Georgia, specific in Augusta City. And sunscreen is expensive, so I know not everybody can afford that.
Oh, yes, absolutely. And in social media, you provide a lot of information about prevention. And talking about that, for people who want to know more about what you do and all this particular clinical research, what will be the best way to get in touch with you?
I started sharing recommendations about cancer screenings in Instagram, because I feel like we as medical doctors, as researchers, we have a lot of information, and a lot of information is scientific concepts, but I wanted to have this in an easy way for the community in general, because that's something that I also do in my work, share knowledge for everybody that wants to be aware that there is a lot of resources out there that we need to be aware of, or anything that doesn't feel as regular as it used to be. It's something that we need to say, hey, I feeling a little bit different. Maybe I need to get screening, or I need to talk with my doctor. And that we can do changes every day, like small changes can make a big difference. So that's why I just create my professional profile, and you can look for me in Instagram. That is the one that I'm using so far, as Dr. Brenda with double N.
And I'm going to provide all the links in the episode description. So I want to thank you so much, Dr. Brenda, for being here with us. If there is a message that you want to leave, what would that message be?
Well, today I want to spread the message out there to all the women that want to pursue a career in medicine. I say, if whoever told you can, they were completely wrong, because you will find a way, you will find the resources. And if you keep walking and asking for mentors, if you are asking for mentorship, you will find a way to succeed. So don't be afraid to ask. Don't be afraid to ask for mentorship. Don't be afraid to start wherever you are.
What a beautiful way to conclude this episode, Dr. Brenda. Muchas gracias por estar aquí y hasta la próxima. Thanks for finding and subscribing to Latina in America so you don't miss a thing. And if you like this episode, give us a 5-star review so we can be put on front of more listeners. For details and show notes and how you can connect with and support our guests, please go to latinainamericapodcast.com. Email us at latinainamericapodcast@gmail.com and follow us on Instagram at Latina in America. Links can be found on the website. This has been Rosie, a Latina in America.